everyone. Dr. Bertley's here.
Hey, how y'all doing? Good to see you all.
He's actually the president at COSI Science Center in Columbus. Yes, he is a doctor, graduate of Harvard, went to McGill in Canada and Harvard in Boston. He's got a degree in immunology.
First rule, there are no bad questions, no wrong questions. So share whatever thoughts you have.
7 women had passed away because they had shortly after receiving the vaccine. And then all of a sudden there was no reformulation of the vaccine itself, but it was only 7 women at the onset of giving the vaccine, then all of a sudden no more deaths were reported.
Yeah, so this is a great point. So you always got to dig into the details. So a couple of things. One, the FDA approves the vaccine. Okay, the FDA is the Food and Drug Administration. That is a U.S. government organization. But they only approve it after a bunch of steps. Step number 1, if you're coming up with a vaccine, you got to share all the information, right? The UK and other countries is a lot easier. US, it's not easy. You got to share all the information. How many people you vaccinated and every bit of data on each person, right? That goes back to this group that studies it. Then you also look at all the company data. So the factories, how clean is it? All these different things, they all get analyzed, right? And then they also look, of course, the data. Is the vaccine working or not? Once all that data is collected, it goes to this separate group, and you've all heard in the news, the Vaccine Advisory Committee, right? That's not a government organization. That's people like me and you, well, when I say people like me and you, non-government employees, non-company employees, but people who are experts in immunology. And so it's a panel of experts who aren't connected to the companies, don't work for the government, they got no skin in the game, and they're the ones that provide the emergency authorization. And so when they provide it, that's an autonomous group that says, okay, this is safe, and then the FDA goes back and stamps it. Now that happened, Johnson & Johnson came out, and you're right, there were, I think, first six, and then one more, 7 women had this blood clot. But you gotta analyze the data further. When they dug in deeper, yes, they had blood clots, yes, they died of blood clots, but it had nothing to do with the vaccine. And that's why you're not seeing many more happen. If it was because of the vaccine, it would have been 7, and then 14, then 30, then 100, then 300. It was a coincidence, right? I mean, there's a lot of people that, if you get a vaccine today and walk across the street and get hit by a car, right? Heaven forbid that happens. Right. You're not gonna say, I got hit by a car because of the vaccine, right? And so it's one of those things where, and what was good though, what I liked is they stopped it immediately.
Yes,
right?
did.
Because they had to check. And so that's a good sign that they said, wait a minute, put the brakes on, and then they analyzed and realized, okay, yes, they did have blood clots, but it was unrelated to the vaccine, and that's why they were able to continue